frequent question asked is how can we personalize or improve outcomes with treatment for any cancer? And in particular, I think GEP-NETs is a cancer that allows us to personalize it at a level that we don't really have with other types of cancers. When you're first diagnosed, we want to determine where the cancer is. And if the cancer is limited to the organ that it started in, a surgeon would be able to perform a surgery in which they can remove the tumor from your body. And when there's too much involvement of blood vessels or other organs, then the safety of the surgical resection becomes a concern. If it is something, a cancer that has spread to other organs or other parts of the body, the goal would really be to maintain the growth or contain the growth of the neuroendocrine cancer wherever it has spread. Chemotherapy comes up as an option for certain types of GEP-NETs. There are some within the GEP-NET umbrella that are very slow growing, and there are some that are more rapidly growing. And chemotherapy tends to be much more effective when a cancer is more active or faster growing. And so ablation basically is a needle probe that is inserted through the skin to the target lesion or tumor. There are different types of energy waves that are then released from the end of the probe and treat the tumor from the inside out. Arterial embolization is another treatment that is used solely for patients who have disease burden in the liver. They will insert a catheter into one of the peripheral veins. Then what they'll do is insert treatment, which typically comes in kind of a microscopic bead, into the blood vessels that supply that part of the branch. So a newer treatment that has been approved by the FDA is a treatment that is given intravenously and takes advantage of the markers or receptors that are unique to neuroendocrine cells called the somatostatin receptors. They're administered this radioactive material through an IV. It goes into the bloodstream and finds whatever tumor cell has the receptor on it. It's like a little tadpole, there's the part that attaches to the receptor, and then there's the tail. So it's binding to the tumor cell, and then it's releasing this radioactive material directly to the tumor cell and resulting in treatment. I typically tell patients when I first meet them and they have a new diagnosis that it is something that we will likely work together on for years and not weeks. And I encourage patients to remain very hopeful. It is a disease that is very slow growing. It is a disease in which we've developed multiple therapies over the last 2 decades, which are well tolerated and very effective.